Hello everyone, I am Dr. Neha Jain, Senior IVF Consultant at Medicover Fertility. Today I am going to do a live session on age affecting fertility. So just for a brief introduction, what is fertility? Fertility is ability to conceive. And so what is infertility or subfertility? Infertility is inability to conceive after 1 year of unprotected intercourse. Now, there are few conditions in which couples might need to seek the help of infertility specialist before 1 year, such as when a woman is 35 years of age or more, if there is a history of ovarian cancer or testicular cancer, if there is a history of surgery on ovary or uterus, or if there is a history of surgery on testis, if there is other medical conditions such as fibroid, adenomyosis, if there is documented decreased ovarian reserve or abnormal semen parameters, then they should seek the help of the infertility specialist after 6 months of unprotected intercourse. So there is a very big myth that biological clock is ticking for females. Biological clock is ticking for both males and females. It is clicking a little rapid for females. So a female is born with a fixed egg reserve, and this egg reserve, unlike the females do not produce eggs. So they are born with fixed egg reserve, which is roughly about 1 to 2 million. In her entire reproductive age, starting from puberty to menopause, a female produces 300 to 400 of eggs. So in a cycle, 15 to 16 eggs are produced, out of which one egg, which has maximum receptors to catch the hormone, it grows, and rest all are degenerated. So a female will use her backup eggs in her entire reproductive age, and a male, they start producing new sperms from puberty, and it will go on till the age of 55 to 60 years. Our roughly timeline of producing sperm is of about 50 to 70 days, on an average 64 days. So if we talk about a male, they are fertile till 40 years of age. After 40 to 45 years of age, slowly the fertility starts declining in males also. So the how the fertility declines in male, the semen volume will be less, the sperm count will be less, the sperm motility will be affected, and morphology will be affected. The DNA of the sperm, the fragmentation increases, which is known as DNA DFI, or DNA fragmentation index. We have also seen that the males who conceive at elder age of 40 to 45, their babies have neurological disorders such as epilepsy, Parkinsonism, and schizophrenia. Also the other disorders such as achondroplasia or dwarfism. There is a very interesting fact that the South Asian females, as compared to their Western counterparts, they start their puberty early, and also the menopause is early. So as compared to the Western counterpart, the South Asian females have a small reproductive age. So now another myth is there that IVF is a backup for the elderly couples. For some reason, if a couple does not want to conceive, or there is some issue, social obligation, then a couple can use IVF in the later age and conceive. So it is a very big myth, because with increasing age, the ability to conceive naturally and the ability to conceive through IVF, they both start decreasing. So now, if a female is of elderly age, and she does not have a partner, she does not want to get married, she has some other commitments such as career or education, or even if she is married, she is not mentally prepared for having a baby. So in that condition, what can a couple or a female do? In that condition, they can go for the social egg freezing. What is social egg freezing? It means that through the IVF procedure, a female can undergo stimulation, and it can retrieve her eggs, and in the lab, either with her partner's egg or with the donor's sperm, she can mix and make the embryos and freeze it. Or she can, if she does not have a partner, she's looking for a partner, then she can freeze her eggs to utilize it in later life when she finds a suitable partner, or if she decides to being a single mother. So now we will discuss what is the ideal age to conceive. So the ideal age to conceive is usually from 20s till 30s. So from it is the 24 to 27 years of age. If a female is in her 20s, then it is the best time for her to conceive. After the age of 30 years, the egg reserve starts declining, and even after the 35 years of age, it starts declining rapidly. So, if a female wants to conceive, the ideal age is between 20 to 24 to 27 years of age, or if you want to take a range, it is late 20s till early 30s. So, now the thing is ki what are the factors. If a female is married, she is having a baby at the age of 34 years of age, and she does not want to have a second baby, then as informed earlier, she can go for egg freezing, or she can go for embryo freezing, which can be used later part. But there should be a gap of about 18 months between her first pregnancy and her second pregnancy. So now there are other factors also which affect the ability to conceive after 35 years of age. With increasing age, there is other comorbidities also, like hypertension, like diabetes, or like other comorbidities. So the medication used for these conditions can affect the quality of sperms also, especially like antihypertensives like calcium channel blockers. Now, is there any question? So, okay, the question is there, is 42 years of age ideal time to conceive? So, 42 years of age is not an ideal time to conceive, though there are many people who conceive and have a healthy baby. But with increasing age, the ability to conceive decrease. So, in a couple who are in their early 20s, the ability to conceive in a per cycle is around 20%. But as the age increases, the ability to conceive decreases, and it is just by 5% after 40 years of age. So the ability to conceive decreases if there is no other issue like career, education, and if there is no financial issue. Then a couple should always try to conceive early, before 35 years of age. But yeah, there is no hard and fast rule that they cannot conceive after 30 years of age, 35 years of age, or after 40 years of age, though the ability to conceive will decrease, and also the ability to the chromosomal abnormality in the babies and the probability of the mental issues in the baby increases with the increasing age. But after 45 years of age, the ability to conceive naturally decreases drastically. So, there is a question from Muhammad Imtiaz. What are the basic tips which helps to maintain fertility in males, do's and don'ts? So the basic tips to maintain a healthy fertility. First of all, the weight should be in ideal BMI, that is between 24 to 25, 20 to 25. There should be no addiction such as smoking, drinking, tobacco, and no type of these addictions should not be there. The male should stop wearing the tight underwears. The use of the Wi-Fi, which also there are many studies which have shown that the mobiles, the radiation from the mobiles and the Wi-Fi, they affect your sperm quality. So this should be used with a minimal use, not excessively and not for the whole day. Though in this era we cannot prevent ourselves from these radiations. The undergarments wore should be not very tight, and there should be eating of the green leafy vegetables and fruits, and regular exercises, and the professional work such as where there is lot of heat, like coal miners, or where the heat is lot of heat is there. Those kind of professions should be avoided if possible. So, Simi Joy, how does the age affects the success rate in IVF? Okay, with increasing age of female, the studies have shown that in the age of 30 to 34, the success rate of IVF is 43%. With the age from 35 to 39, the success rate of IVF is around 35%. And after 40 years of age, the success rate of IVF is only 11%. So the other factors also determine, but the age is the most important factor. So what are the other questions? What are the treatments available for infertility problems? So see, the infertility problem is basically not an individual problem, it is a couple problem. It involves both male and female partners. So as we are talking today regarding age, there are other factors. What is the duration of the marriage? What is the problem in the couple apart from the increased age, or if the age is not increased, whether the tubes are normal, whether the uterus is normal, how much is the ovarian reserve, how is the semen parameter, sperm count, motility, and what is the morphology, and whether there has been previous pregnancy or not, whether it was a live pregnancy or there was an abortion or there was an ectopic. The treatment options can be ovulation induction, in which we can use tablets or the injection to grow the eggs and the couple can try naturally. Then there is IUI, that is intrauterine insemination. Third one is IVF, that is in vitro fertilization. So what are the question, Renuka? What would be the best treatment for women who is 36 years of age, married for 6 months but not able to conceive? As I have answered earlier, if a female is 36 years of age and she is been trying for 6 months, then she should meet the infertility specialist immediately. They should go for the baseline investigations, and depending upon whether what is the issue apart from the age, how is her egg reserve, tubes, uterus, and how is the semen parameter, the treatment can be decided. Sushmita Pai, delayed period cycle will affect fertility. Yes, the delayed period cycle can affect fertility. The one of the most common reason for the delayed period cycle is the polycystic ovaries. It can be because of the thyroid issue, or it can be because of the prolactin issue, or so these we need to find out the cause. We need to treat the cause, and depending upon the cause, the treatment is given. What's the correct age to plan baby? Question asked by Anusha Ajay. So the correct age, as I have told, the correct age to plan the baby is ideally between the 20 years of age, from the 24 to 30 years of age. If there is, the female should be mentally prepared, and if there is no other reason, then the couple should try to plan the pregnancy within 2 years of marriage, I would rather say. How can I have a check on my fertility rate? Just married and trying to conceive. Bharati Reddy Mancheria. So if you are just married, first of all, you should, I hope you are less than 30 years of age. And if you are more than 35, even if that not is an issue, if you are less than 30 years of age, you should try to have an unprotected intercourse, that is without any contraception, and regularly from day 6 of your cycle, since the period stops, alternate days till day 22 to day 23 of your cycle. And you should try for at least 1 year. But if you are more than 35 years of age, and if you know if there is any issue, like there has been any surgery, or if there is any documented ovarian reserve, decreased ovarian reserve, if there is a history of early menopause in the family, then you should seek the help of the infertility specialist. Male fertility can be reversible. How do sperm count can be enhanced naturally? Siri Darling. So, male factors, depending upon the cause, usually they can be reversible, but in very few causes. Usually, there is no definitive treatment to reverse the cause. So, it depends upon mainly what is the cause of the male infertility. Suppose if it is a mild male factor and the male is smoking a lot, if he is having alcohol addiction and all, maybe de-addiction can help with the semen parameters. And what was the next question? How to increase the sperm count naturally? So keeping your BMI in a ideal range, that is between 20 to 24, exercising regularly, no smoking, no alcohol, and then eating green leafy vegetables, less use of mobiles and Wi-Fi, no unnecessary use, and not wearing very tight undergarments, not working in a very hot condition. These can help to, I would say, retain the your semen parameters. But there are no other medications or method to enhance it as such. At what age, where is the question? What are the basic tests to rule out male infertility? Question is by J. So the basic test to rule out the male infertility is semen analysis. In semen analysis, the semen volume is checked, the sperm count, which should be more than 15 million, the sperm motility, the total motility should be more than 40%, and the sperm morphology, which should be more than 4%, and if there is no pus cells or any other abnormality. So the semen analysis is the basic investigation to check for the male fertility. What are the worrisome factors for the female infertility by the SK Manisha? The worrisome factor depends upon the age. If the female cycle was 28 days or 30 days, then slowly it has started declining. Like it is 24 to 25 days cycle, now it is 20 to 21 days, the flow has decreased. If there is a family history of early menopause at 40 years of age, if there is a documented infertility history in her mother or sister, then these are the, if there is a history of ovarian cancer or any surgery on the uterus, or she has taken chemotherapy for breast cancer or any gynecological cancer. So these can be the factors which might decrease the fertility in women, and they should seek the help of the fertility specialist wherever required. So, um, okay, I am looking for more questions. How do male fertility is treated by Nagaraju Polusa? So, the male, there is no definitive treatment, I would rather say. the male infertility depends whether it's a mild male factor, it is a moderate or a severe male factor. Factors the couple can try naturally, or they can try IUI. But if it is a severe male factor, then most of the time the male might require IVF. So other factors also determines the treatment. And if you are asking about any reversible treatment which can improve the male factors, so sorry, there are no documented, or even if there are the treatment present, the success rate is very low. So I think I have answered most of the questions, and if do you have any other queries, you can call on this given contact number. And it was nice talking to you. Thank you.